More than 50,000 people globally have now died from the coronavirus as the number of infections surpasses 1 million. Hello, I'm Anand Naidu and this is The Heat. It's gone from bad to worse for American workers as the United States struggles to contain the coronavirus. New jobless figures show a record 6.6 million workers applied for unemployment benefits last week, and it's estimated by the end of April, 20 million jobs will be lost. Europe remains one of the hardest hit regions. The death toll in Spain passed 10,000 on Thursday, with the country reporting its highest number of deaths in a single day. The United States leads the world in total cases, and federal stockpiles of medical supplies are said to be dangerously low. CGTN's Giles Gibson is monitoring developments from Washington, D.C. He joins us now. Giles, U.S. President Donald Trump just wrapped up his daily briefing at the White House with his team. Unemployment, top of the agenda. What is the administration saying about that?
Well, what the administration is trying to do is really try to roll out some of the programs that made up that $2.2 trillion economic relief package that was passed and signed by the president last week. Now, that includes direct payments to U.S. taxpayers, either via check or actually direct deposit into Americans' bank accounts. For example, if you earn less than $75,000 a year, then you are entitled to $1,200 direct from the federal government. Now, Steve Mnuchin, in that White House briefing that just wrapped up, the U.S. Treasury Secretary, he insisted that those payments will start arriving in Americans' bank accounts within the next 2 weeks. However, we have had a leaked memo from Congress, which has been reported widely in the U.S. media here, saying that some Americans might have to wait 5 months before they receive these payments, which of course in some cases are desperately needed.
Giles, right now over 90% of Americans are staying at home, but the number of U.S. cases is still on the rise. How is the Trump administration responding to hard-hit areas like New York?
Well, New York is just a perfect example. It's really the hardest hit area in the country right now. According to the CDC, the Centers for Disease Prevention and Control, there are now more than 80,000 cases in New York State alone. We're also seeing some big numbers, some rising numbers in places like New Jersey, Michigan, and the city of New Orleans. New York's Governor Andrew Cuomo earlier on warned about the number of ventilators that they have in the state right now. He said that the ventilator stockpile for the state is going to be depleted in the next 6 days, so in less than a week. Now, the Trump administration are trying to respond to some of those cries for help from these governors. President Trump has now invoked the Defense Production Act to try and boost the numbers of ventilators that are being manufactured in the United States to try and keep up with that extraordinary demand that we're seeing in places like New York City.
This is a 2,500 and/or 2,900 can easily be set up hospital built in Javits Center, and so we're going to be converting that to a COVID-19 hospital, and it's going to be staffed by the military and by the federal government. And based on the fact that I agreed to that, we had 2 other facilities that were likewise asking for it, and that would be in Louisiana and also in Dallas.
Now, that was President Trump talking about some of the response from the Trump administration, trying to boost the numbers of ventilators and the numbers of hospital beds in some of these hardest hit areas, including New York City.
Okay, thanks, Giles. That's CGTN's Giles Gibson reporting there. Well, for more on the coronavirus pandemic, let's bring in our panel. Joining us by telephone from Beijing is Qinduo Xu. He's a senior fellow with the Pangoal Institution and host of CGTN's Dialogue Weekend. From New Orleans, Louisiana, Eric George is a physician treating COVID-19 patients at Omega Hospital. And right here in Washington, D.C., Mary Lovely is a senior fellow at the Peterson Institute for International Economics and professor of economics at Syracuse University. Thanks to all of you for joining us. Dr. Eric George, let me start with you. The state of Louisiana, also another one of these areas which has been very hard hit by the coronavirus. What can you tell us about the situation there?
Well, the situation is really tough here. I know you hear that on all of your specialists that you've spoken with, but Louisiana has had 2,700 new cases just in the last 24 hours. So we're at 9,100. We have about 310 deaths, and we like this to the Katrina crisis in that we're seeing this big spinning storm out in the Gulf, and it's heading our way. And if New Orleans is any reflection of what we've seen in New York, we're getting ready to get hit on even harder. And we definitely see a peak that's climbing, and we're running into all the problems that you're so familiar with: lack of PPE, ventilator needs, etc.
And Eric, what about testing in Louisiana?
Well, we were one of the early test centers, so we started a little, I would say a little bit ahead of the curve, and not as ahead of the curve as we should have been on all of this. And some of our testing stuff is starting to come in. We still have the issue of getting the results back. Still a 4-day, 5-day turnaround. Recently, we've gotten some information from the state that they have a lab that can process these in 24 hours. But as you know, it's so important to know the status of the patient's condition to render care and how to isolate or not isolate those patients.
All right, let me bring in Mary. Mary, looking at the economic picture in the country, we heard this morning 6.6 million workers in the United States applied for unemployment benefits. Of course, you've got to add in the 3.3 million who applied for the same benefits about 10 days ago. Are you surprised at the speed and magnitude of the unemployment problem?
Well, of course, this buildup in unemployment is completely unprecedented. So we're all just surprised. We're not surprised having watched what happened in China and then watched what's happened in Italy. So over the last few months, we've really got an education in how fast this virus can close down an economy. So in that sense, it was expected. I think the number today, which was staggeringly large, was larger than most analysts had expected. It does tell you how fast things are closing, how many jobs are being furloughed or workers laid off, and we don't know really how many of those will come back and at what speed. So we're looking at a labor market catastrophe right now here in the United States.
I mean, when you look at it, why are so many people losing their jobs when the government is promising these huge bailouts for not just big corporations, but for small businesses as well?
I think the government, federal government, has a credibility and implementation problem. People have seen the implementation of support for hospitals, for local areas, basically goofed. Here in New York, we still are waiting for lots of responses. The president today announced that the Javits Center was going to be transferred into a COVID-19 facility. That's something the state has been asking for several weeks. All of a sudden, we kind of get this announcement today. So I think when we look at small businesses and they're saying that they're going to get a loan, we don't really know how the businesses will access the loans, what kind of certification banks will require. And most importantly, I think small businesses don't know if there'll be demand on the end of this for them to, regain their businesses. They can retain workers, but, ultimately they have to have a market. And right now, I think the government is not providing the confidence that small business owners need to believe that that market will be there. And as a result, they're letting workers go.
Okay, let's go to Beijing to Qinduo Xu. Qinduo Xu, glad to have you with us. I want to ask you first about a report that we got earlier today about a situation in Henan province in China. We understand that there is a county in that province, Jia County, where it's a county of about 600,000 people, which is on lockdown right now because some instances of COVID virus have been found there. Do you know anything about this? Could you tell us anything about it?
Yes, this is the so-called, the fear of the second wave of infection. Despite this achievement made by the Chinese side, you see, in general, the country is gradually returning to normalcy, I would say. You see, business activities are coming back, shops are being open, people are coming out to do their, the normal businesses. But for this particular instance, there's one infection, and it was traced back to a local hospital. And then there's alarm. You need an investigation to see where it is originated and how many people have been in close contact with this one infection. And then there's a lockdown. Basically, the county goes back to the lockdown mode. We don't know how long it will last, but probably the lockdown won't be off until the full investigation is out. So this is it just gives an example of how easily things would be affected if there's an instance of unknown infection. That's the concern for a lot of people here.
Qinduo Xu, I want to look at the bigger picture now. China has sent to Italy 1,000 ventilators, 2 million masks, and a team of doctors. And we also hear that Beijing has made large donations to African countries and has pledged $20 million to the World Health Organization. What can you tell us about the country's global outreach right now?
Well, for China, I think it's in general, it's in a position of offering assistance, let's say, because China is a manufacturing hub of medical supplies, in particular the face masks, both for surgical use, for medical use, and for non-professional use. So the plants and factories for those supplies are in full steam. And also you have, for example, some of the other companies in other businesses, they are turning their production line into producing the medical supplies. For example, automaker BYD has changed some of their manufacturing into mask production. So you do have more and more production capacity. China produces, I think the daily capacity is 100 million for masks. So it's beyond the use, self-use of the Chinese population here, because everybody is using masks when you are out. And also for the plants, you have your workers to come back to work. And according to the government regulation, and you have to provide adequate protective gears for your workers and for everybody, even in office. So there's a lot of daily consumption of those medical supplies. But beyond that, I think China is in a position and is able to provide the assistance or provide the other medical supplies to sell to other countries. Yes, Africa is in particular, we know the healthcare system there is vulnerable. They need a lot of supplies, either from China or from other organizations and other countries.
All right, let's bring it back to the United States, to the state of Louisiana, and back to Dr. Eric George. Eric, the Louisiana governor, John Bell Edwards, he's extended that stay-at-home order until April 30th. And he also said that New Orleans could run out of ventilators by the weekend. You know, we saw these pictures that came out of places like New York, even up in Washington state, where doctors were really overwhelmed because of a shortage of equipment and the numbers of people that were coming in. How is the healthcare system coping in Louisiana?
Well, we are in the same situation. And, I think about 7 to 10 years ago in this country, the hospital systems kind of changed their gears a little bit. They used to carry a tremendous amount of inventory. And as the marketplace changed, everyone stocks just enough or a little bit beyond what they have. And typically in hospital networks, and all of us in healthcare know this, that if you run a little short, you borrow from your neighbor hospital or from some other facility, and then that's replenished. we have not done a good job here in having a large amount of inventory. And I think the fact that most hospitals, cost conscious, try to just buy what's necessary and maybe a little extra overrun. And that's really hurt us here in that everyone is looking for ventilators, everyone is looking for PPE, and we used to reach out to our neighbors and they don't have it as well. So I do believe we're going to have a large need for ventilators. What we're seeing in the hospitals every day is more and more patients are being converted from respiratory distress onto supplemental support, or what we call respiratory rest, through a ventilator.
Mary, going back to the jobless numbers here in the United States, we get these questions asked all the time whether people would ever be able to go back to jobs, or will those jobs disappear? Will there be new jobs coming along? I mean, do you foresee a situation where we could ever get back to those really low unemployment figures that we had just about over a month ago?
Well, we're enjoying quite a long run of low unemployment in the United States, and it is possible we could get back. The economy was on gear to maintain growth throughout 2020 and 2021, and at this pace, in what was a very long, expansionary phase, it was actually quite solid. So there is a possibility that we could get back. I think we are going to watch China, and we're going to see how fast it can return to normalcy, and what happens there in terms of businesses being able to come back. There's no doubt that the large businesses will be able to weather this. We're seeing employers all over the place, large and small, doing everything they can to retain workers. But we know that there are a variety of arrangements for workers, temporary workers, so-called gig workers, and workers who are working multiple jobs. And for these workers, I think they are our most vulnerable, and it's hard for the government to get aid to them quickly. We're not a nation that has a very solid safety net. If we compare the United States to Europe, for example, where the Europeans are doing wage replacement policies, we see in the United States, it's harder for us to get money quickly to the people who need it most, because we simply don't do it other than through a few programs like the Earned Income Tax Credit, like SNAP or food stamps, food aid. And these programs are simply not up to the level of support that is needed during this crisis.
Okay, let's go to Beijing. Qinduo Xu, there are reports coming from China that the country is stepping up the screening of people infected with the virus but who did not initially show any symptoms. What do you know about that?
Yes. For those people who don't show symptoms, they were not listed previously as one category. But it was registered, obviously, and also those people mostly have been put under close monitoring over there. And starting from this week, and then there's like a daily announcement about the number of those people asymptomatic, the number, whether there's a growing number of them or there's a decrease of the number of them. And of course, people are very concerned, whether they are infectious or not. If you have close contact with those people, whether that will put you in danger. But in general, they say their contribution to the infection is very low, about 4.4%. All those people, according to the announcement, that all those people without symptoms, obviously they have been in contact with someone who has been diagnosed and probably received a treatment. So in that sense, for the folks who don't have close contact with any patient, probably there's no need for you to test because there's 1.4 billion people. If you want to test everybody, it's simply impossible. So it's still focusing on the infection and those in close contact. Some of them in close contact probably they don't show symptoms, and then they will be put to the close monitoring and for 14 or 28 days to see whether they will develop any symptoms or whether they will develop antibodies. So more tests will be done on them to see how it develops. and then to make sure they will go back to the society as one of the normal, citizens over there. So it's the number in total number is like more than, I think, 1,500. There's small increase in Hubei province yesterday. Last 24 hours, it's about like 34, 35. So there are increase of those asymptomatic, I would say, people over there, but it's not a large number yet.
Eric, looking at the situation in Louisiana, as you told us earlier on, the number of infections right now, 9,100, 310 deaths. Has there any work been done to track down why the New Orleans area, people in the New Orleans area were infected in such high numbers and so quickly? Because we did hear some speculation about the fact that this could have started with the Mardi Gras in New Orleans.
Yes, sir. I think that for those of you who have traveled to New Orleans, understands our culture is very, very, very people-oriented. Many of our festivals and our events are large crowds, close together, celebrating those things that all of us wish we could do now. And that social contact is what makes this place one of the favorite destinations. Unfortunately, that social contact is exactly what a virus absolutely loves and has picked to target those people that are in those close-knit networks. We were a little behind on getting the testing going. We had difficulty getting the tests once we ordered them, and now we're finally starting to see some of those results come in, and that may be also what's skewing a little bit of the fact that we had 2,700 new cases in a 24-hour period, and that is the testing is starting to turn the corner for us. I think that, we know now, we're learning every day about this virus, and it's very confusing for us. We see the elderly and the infirm, but now every once in a while we'll have a very healthy patient who doesn't seem to fit the criteria at all become really sick. So viruses, as you know, I'm not a virologist or an immunologist, but they convert and change, and we fully don't understand this. So we're working every day, not only looking at how we can test patients, but how we can find some way to determine who's post diagnosis and now has the antibodies.
Mary, in addition to the stimulus package that was passed in Congress just about a week ago, there's now also speculation on a multi-trillion-dollar infrastructure package that, theoretically could create a lot of jobs. What will that do, and do you think that is now indispensable? We have to get that.
I think many people are worried that the infrastructure project will just be too late, that it would be hard to get it going. We are still in with stay-at-home mode, basically a form of lockdown here, and I think it's very difficult to see how that can get, the need that people need quickly. We are now seeing these unemployment insurance numbers really spike, and we're beginning to see the need is immediate. And we have many people in the United States who don't have big reserves, don't have funds to last. The next thing we're going to see is, of course, that rents are unpaid, utility bills are unpaid. So we're going to see that sort of lack of funds spiraling throughout the system to landlords, to banks, to utilities. We're already seeing it in state budgets. The New York state budget is going to be in a very difficult situation. States have to balance their budget, unlike the federal government. And for some states, there was really very little relief in the $1 trillion stimulus package. So I'm surprised that they're talking about infrastructure. Of course, there's a huge need of infrastructure in the United States. What we seem to need right now is employment support to keep those people attached to their employers and able to get back into work relatively quickly when the economy comes back.
Qinduo Xu, there has been some criticism that China has underreported the number of infections. According to figures kept by Johns Hopkins here in the United States, China had 82,000 infections with 3,200 deaths. President Trump did say that those numbers were on the light side. In fact, United States media have been reporting, citing U.S. intelligence sources, that the figures were underreported. When President Trump was asked about this yesterday at his briefing, he says he knows nothing about that. He doesn't actually know what the numbers are. In fact, he said, I'm not an accountant from China. But today we hear that these intelligence services produced a report to the U.S. Congress, which say that, again, that China underreported numbers. So it seems what the White House is saying and what the intelligence services in the United States are saying are two completely different things. The Chinese Foreign Ministry has responded. In fact, they referred to these reports in the United States and called them morally repulsive. What are we to make of this?
Well, first of all, there's no incentive for the Chinese side to hide those numbers. Remember, because you have like more than 8,000 cases. What's the difference between 8,000 or 9,000 or 10,000? It doesn't make any difference in terms of the overall situation, remember. And secondly, if you are asking for accurate number of these patients and also the death toll, no country can do that scientifically, because remember, Wuhan is a city first hit by the disease. And at the very beginning, nobody knew anything about the virus, whether it's a repeat of SARS or whether it is a new virus over there, and how it transmits from people to people, or whether it transmits from person to person, and how contagious it is. So there are people probably who got infected and died from this disease, and obviously they were not included in the counting of the bodies over there.
Right.
And of course, so that's on one hand is understandable, and also, if you see, because China has this resources and also strong mobility, you see you have more than 40,000 professional workers went to Wuhan to support the city. I don't think, I would say very few countries can do that.
Yeah.
So that helped reduce the number of infections and also reduce the number of deaths.
Okay. Eric, very quickly before we go, we've got about 30 seconds, unfortunately. Time's caught up with us. But, one of the things we've seen during this pandemic is the toll that it's taken on healthcare workers, people like yourself, doctors like yourself. Are you concerned about your own personal safety, about your health?
Yes, sir. I think most physicians, or I should say all healthcare providers, have a mission to care for your patients. And that takes priority for all of them that are out there in the field. I think about my nurses every day and the other doctors that are plugging along. But yes, sir, I think, we want PPE, and if we do it right and we have the equipment, we can do it. The problem is we're reusing supplies, trying to wash things. It's gotten tougher.
Okay, thanks so much. Thanks to all of you for being with us. That's all we have time for on this edition of The Heat. We leave you with pictures of solidarity from around the world. I'm Anand Naidu in Washington, D.C. Thanks for watching.